Reflection about obsessive compulsive disorder. Carissa Eeds, Psychopathology 5113. Dr. Jerry Ellis, Mid-American Christian University, March 3, 2024. Obsessive compulsive disorder, or OCD, is a mental health condition characterized by a pattern of wanted thoughts known as obsessions and repetitive behaviors called compulsions. According to Osmosis from E. Silver, 2016, OCD affects 3% of the population, affecting both men and women, 2016. Obsessions or intrusive thoughts. People with OCD experience persistent, distressive, intrusive thoughts or mental images. These thoughts are often irrational and cause significant anxiety. According to the American Psychiatric Association, 2022, obsessions are not pleasurable or experienced as voluntary. They are intrusive and unwanted and can cause marked distress or anxiety in most individuals. Common themes of OCD. Obsessions can revolve around themes like contamination, harm, symmetry, forbidden thoughts, or fear of losing control. Examples of OCD are fear of germs, worries about safety, or disturbing sexual or violent thoughts. As it comes to compulsions or repetitive actions, compulsions are repetitive behaviors or mental acts performed to alleviate the anxiety caused by obsessions. Examples of this could be excessively hand washing, checking locks repeatedly, counting, arranging objects symmetrically, or repeating phrases silently. Obsessive thoughts can be like a relentless storm, whirling, twisting, and taking mental form. They invade our minds, uninvited guests, a ceaseless loop that never rests. Obsessions cling like stubborn vines, demanding attention and weaving intricate designs. They latch onto fears, doubts, and what-ifs, a mental maze, a relentless drift. Compulsions come in unrelentingly, side by side like a silent tide. They invite us to follow in their footsteps, a dance of repetition and overwhelming longing. Checking the never-ending checking, switches, stoves, locks, things that blow our thoughts. Have I turned it off? Is the door lockable? Compulsions murmur, do it again. Fingers tracing beads in a ritual entrance, counting numbers like a siren's call, 1, 2, 3, again, 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 finding comfort in this repeated sequence of numbers, cleaning, rubbing raw, red skin, and persistent fear of contamination. As the water flows, the stain is removed. Still, the compulsions endure like an unbreakable link, putting things in proper order, finding symmetry among chaos. Pencils were arranged precisely, books lined up, and compulsions set the daily pace. The DSM-5 criteria lists obsessions and compulsions, or both, time-consuming and distress daily life, not physiological effects or substances or medical condition, and not better explained by another disorder. This is the criteria to meet this diagnosis for the DSM-5. Pathways in the brain, etched deep, a tangled web where obsessions creep. The mind is a battleground of thought where obsessions and compulsions are tightly locked. Dr. Stano Rege, 2023 states, obsessive compulsive disorder has a complex pathophysiology involving both biological and neural factors. Let's explore some of these insights. The biological basis includes a neuronal loop. OCD is associated with dysfunction in the neuronal loop that includes the orbitofrontal cortex, the cingulate gyrus, the stratum, globus pallidus, and the thalamus. Dopamine serotonin imbalance. An imbalance between dopamine and serotonin neurotransmitters is implicated. The again exalts for the biological basis. Brain injuries, infections, or drugs affecting these ranges can lead to obsessive and compulsive symptoms. The functional neurotomy includes hyperactivity. Functional brain images studies reveal hyperactivity in certain subcortical and cortical regions. It can also include inappropriate activity. Inappropriately increased activity in the head of the sedate nucleus inhibits globus pallidus fibers, leading to increased thalamic activity. The thalamic circuit, primitive cleaning and checking behaviors, may be hardwired in the thalamus. Next, we will include impact on daily life. OCD interferes with daily functioning, relationships, and overall quality of life. It is time-consuming. Compulsions can take up significant time, affecting productivity. Distress. The anxiety caused by obsessions and the need to perform compulsions can be distressing. Treatment options include cognitive behavioral therapy, or better as exposure and response interventions, ERP. This is a common CBD technique. It involves gradually facing fearful situations without performing compulsions. Medications include SSRIs and can help manage symptoms. The combination, often of therapy and medication, yields the best results, although medication used to treat this diagnosis can have severe side effects. Thank you for listening to this discussion. Have a good evening.